Okay, so we'll get started here. Hello, everyone, and welcome. My name is Savannah Panagopoulos, and I'll be your host today for today's webinar with the North Texas Poison Center. Thank you for your time. This week is National Poison Prevention Week, so our goal is to spread awareness and hopefully prevent poisonings from happening in our community. At the end of our presentation, we'll have a Q&A, so feel free to add any questions in the chat or ask. And also please be aware that this session will be recorded and made available through website and social media links to inform and educate the public on this topic. So if you choose to participate in an identifiable way, you acknowledge that your image and or name will be recorded and are authorizing the use of your information in the recording. So you may turn off your video and participate under an alias if you wish to stay anonymous. And I would like to introduce our guest speaker, Lizbeth Petty. Lizbeth is the Public Health Education Manager at the North Texas Poison Center and also a very long-term partner of ours at Safe Kids North Texas Fort Worth. So I will pass it over to you, Lizbeth, and thank you for being here today.
Yeah, absolutely. Thank you so much for having me. I'm excited to share some information about the North Texas Poison Center and the services that we provide. And so we'll just jump right into it. And so again, my name is Lizbeth Petty, Public Health Education Manager at the North Texas Poison Center. I've been here going on my 6th year. Even in my role, I am still learning quite a bit about poisons. As you'll see, we consider poisons to be lots of different things. And so I always start with the definition of what a poison is. A poison is basically anything that can make you sick, hurt you, or kill you if you use it in the wrong way or the wrong amount. So you ask most people, what is a poison? And of course, they're going to give you answers like it's a toxic gas or it is a very strong chemical. However, we consider poisons to be things that are very commonly found in and around your home. And our mission at the North Texas Poison Center is basically to reduce deaths and injuries associated with poisonings. And we have 2 ways of accomplishing that. The first way that we accomplish that is by providing the poison helpline. So in case of a poison emergency or when you have a poisoning concern, you dial 1-800-222-1222, and one of our specialists picks up the phone call and provides treatment or advice. The second way that we try to reduce deaths and injuries is by providing free education in Texas. And so we do community health fairs and presentations, as you'll see along the presentation, to really help accomplish our mission, because we believe prevention is the best medicine. And so our goal is to really get information out to the general public in hope that they will create a change that can possibly prevent a really serious injury or poisoning. Just to kind of give you a brief overview of what the network here in Texas look like. We have 6 poison centers in Texas. So I mentioned I'm with the North Texas Poison Center, but we're also commonly known as Dallas Poison Center because of where we are located. But all in Texas, you can find several poison centers all around the state. And together we make up the Texas Poison Center Network. We work together to answer your call. So at any point in Texas, if you dial the 1-800 line, any of the poison centers in Texas may pick up your phone call. And that is okay. We all provide the same information, but our goal is that you do not have to stay on hold or wait for somebody to pick up your phone call. And especially because of the nature of calls that we receive, right? Usually if somebody is calling the poison helpline, it's because an emergency has happened or they have a question they need right away. And so we do our best to not keep you on hold for more than 30 seconds. And that's a great part of being a network. But not only are there 6 poison centers in Texas, there's also poison centers all across the United States, and we all share the same phone number. And of course, we all share the same mission, is to reduce injuries and poisonings. A little bit more about the North Texas Poison Center. I mentioned we are in Dallas. We're actually located at Parkland Hospital. We span out to 42 counties, so we're not just limited to working in the Dallas area, which is how we're able to collaborate with Safe Kids North Texas. The regions that they cover, we also cover as well. We are open 24/7 for obvious reasons, right? Poisoning is going to happen any time of the day. One thing that a lot of people don't know about calling the poison helpline is that every time you call, it's a registered nurse, a pharmacist, or a medical doctor who picks up your phone call every single time. So not only are these healthcare professionals licensed, before they can pick up your phone call, they have to go through an extensive amount of training in the field of toxicology. And so they actually have to get certified nationally through the American Association of Poison Control Centers, who accredits every poison center in the US. So think about that next time you think of the poison helpline. It's not a volunteer, it's not a machine like most numbers. You know, if you call your pediatrician for a question, you're not going to directly talk to the pediatrician. You're probably going to talk to the nurse or leave a message. Know that when you call us, you're speaking directly to the provider who's going to give you that treatment advice. Not on here, but we are completely confidential, very important, right? So, you know, poisonings happen in the blink of an eye to small children. And I know there's a fear of parents who they might have concerns that if their child got into something, they might get in trouble, right? We are not there to get you in trouble. We're simply there to take your phone call and tell you exactly what you need to do. And so that call is exactly between you and the provider who answered your call. We're also completely free. It doesn't cost you anything to call the poison helpline. It's no charge to you. To give you a better idea of what we do, and these numbers are actually higher now. So we answer more than 60,000 calls just at my poison center. In fact, in Texas, we get a call about every 2 minutes. So we stay quite busy. Last year, actually, we handled just in my poison center alone, 84,000 calls. Because of COVID, there was an increase, of course, in exposures to cleaning products. And because we, of course, wanted to make sure we maintain our house sanitary. And so more exposures, whether it was ingestions or they were eye exposures or skin exposures. What this slide basically tells you is that a huge portion of our calls are just human poison exposures. So what does that mean? It just means that someone like you or me, somebody in the public, in the community, is calling the poison center because something happened. Another portion of our calls are for toxicology related information. So what does that mean? It means maybe perhaps you have a medication that maybe took out of its original container, and you're not sure what kind of medicine it is. And so you're looking at these pills and you want to identify them. So we get a lot of pill IDs. It might be a police officer calling us in the middle of the night because maybe they pulled somebody over who had some unidentified substance on them and they need some help identifying that. It might be a senior adult who is unsure, maybe uses a pill minder and is unsure which one's the diabetes medication, which one's the one for high blood pressure. And so they have a question about that. A smaller portion of our calls are medical toxicology consults. So what does that mean? It means that when somebody goes to a hospital for a poisoning, okay, those doctors and nurses in the hospital, they're actually often calling us for the poison emergency because we are the poison experts. So I know, Safe Kids North Texas being at Cook Children's is one of the organizations that we most certainly get calls on because they work with a pediatric population, and often those ingestions require that they consult with our toxicologist. So it's a great service. We also have a partnership with the UT Southwestern Fellowship Program. And so often if our specialists don't have an answer, they'll get an answer for you from our toxicologist. And then a smaller portion of what we do is we do community programs, and we also send out tons of information, reaching over 60,000 people with brochures and magnets and stickers, things that really promote the poison help number. So a lot of you might be wondering, so what kind of information will I need when I call the poison helpline? Well, there's a few things that we need to better serve you. So when you call, we might ask you for the age of a patient. Did it happen to a child? Did it happen to you? Did it happen to an older adult? Maybe what symptoms that you or they are experiencing. A little bit of medical history, because we know some poisonings can definitely be more severe if there's medical history that can counteract that. The strength and the dose of the product. So often we ask you that you have the product at hand if it's available, because we might have you read out some of the ingredients on the product, usually the active ingredients of what we're asking for. And if some of those words can be really hard to read, no worries. Our specialists are there to take your call. They can have you spell it out. So don't worry about having to know exactly what ingredients are in those products. How long ago did it happen? That's really important. There's a misconception that poisons can hurt you right away, but in fact, there are some poisons that are delayed in symptoms. And so we want to know, when did it happen? Your name, phone number, and zip code. I mentioned that we are confidential, and we certainly are. If we ask you for this information, it's because maybe we want to do a follow-up. So maybe there is an ingestion and we tell you everything's going to be okay, but we want to follow up within the hour or the 2-hour mark to make sure everything's going okay. The phone number to give you a call back, your zip code, not because we want to find you and go look for you, but we might ask for your zip code because we also do public health monitoring. So maybe we get a trend in calls about a specific substance in this area. And so that tells us a lot. That tells us that we need to mobilize our educational efforts in that area to reach those people and provide some education around that topic or that substance, or we can alert the health department, or we can alert our community health partners that there is a trend in the community in this specific area. Your relationship to the patient, you might be the parent, so we might want to document that for our call back. You might just be the provider calling from a hospital. You might just be the school nurse calling from the school. Maybe you had an exposure there. And so information, again, just to better serve you. We often have people who may not be comfortable giving us a name and phone number. That is absolutely okay. So we have over 20 specialists at my poison center. They answer your phone calls, and for our 42 counties, we have 2 educators. So I am really thrilled to announce that we have brought on a new public health educator. You'll see here on the left, Vanya Atal. And so she is currently in training with us, and she'll be able to attend community events and do presentations as she finishes her training. I've already mentioned that I've been there for over 5 years. We have backgrounds in public health so that we can better understand the needs of the community and serve those areas. And of course, we are bilingual, being that we are in a poison center that really serves a highly predominant Hispanic population. We want to make sure that we can get our messaging across in English and Spanish. I didn't mention that we actually offer services, language services in over 150 languages. And so if anybody does not speak English or Spanish, that is not a problem. We have a translation service. So we offer free educational programs, right? I mentioned that as part of our mission is that we want to educate our communities. And so we offer presentations to all age groups, all settings. And so we'll often go to parent meetings, whether it's PTAs, summer safety camps we do every year, senior groups, senior centers. We often are doing a big majority of our work in schools. And so if you have a child in elementary, middle school, or high school, there are schools that we go to regularly. And so some parents often tell me, yeah, my child brought home a magnet or an activity book from school. They had presentations. That's because we are very trusted in the community. We are known as a legitimate source of information. And so schools often invite us to speak there. But not only do we do that for the public in our community, but we have a clinical educator here at the North Texas Poison Center, and her focus is more on healthcare professionals, so physicians, nurses, and doctors. So she's often doing presentations to nurses, maybe perhaps on snake bites, how to better treat snake bites when they have a patient come in, or on drugs of abuse, identifying those different symptoms and how to treat that accordingly. And of course, how to utilize the Poison Center. And so now I'll just briefly go through some of the programs that we offer. But we offer programs for kids and teens in various topics, being from the most basic poison prevention lecture to speaking to middle school and high schoolers on our vaping program. And so here is one of the schools that I attend almost every year in Garland. And they have me there because, you know, kids need to hear the messaging more than once, right? The programs for parents and adults we offer as well. We've added actually a couple that might not. We have a nature's hazards, which is great to learn about bites and stings, but we also have life-saving lessons. And I'll go through these a little bit more in detail to kind of tell you what they are composed of. So for children, our Be Poison Safe program is about 30 minutes. We know that children don't have a huge attention span, and so we often don't try to keep our presentations in longer than 30 minutes, usually sometimes less. We gauge our audience. So one of the great things about being in the public health field is that your education really trains you to tailor your messaging to different audiences, but we teach them basics. What is a poison? How does it get into our body? What would you do if somebody gets poisoned? And we tell them about the poison helpline because we want them, when they see the logo and the number, to recognize that is a number that is important that everyone needs to have in their home. And around kind of later elementary or even into middle school, we offer over-the-counter medicine safety program. We know that these children all eventually will become adults and all will be taking medicine on their own. And so we want to equip them to learn about medicine safety now, right? Teach them what is dosing, teach them what's on a drug facts label, and tell them about medicine misuse, right? A lot of kids, they have a misconception that only medicines that you get from a doctor are dangerous. And so we want to make sure we're giving our students factual information so they understand and we have good, healthy habits as they transition into older adults. Our drug trend program actually came out of really need for education around these specific substances. So a lot of our programs are based on the data that we see, the volume of calls that we see at the Poison Center. And we saw that, of course, we get calls about tobacco and alcohol, but we also get tons of calls about prescription drugs, being that we're still in the midst of a prescription drug epidemic. There's a need for that education. One of the wonderful things is working as a partner, for example, with Safe Kids North Texas, as they launch their own program. We get to collaborate on that messaging because our goal is the same. Our goal is prevention. And synthetic drugs. And so there's different topics in these brochures that we offer as collateral, as a giveaway. And then we also entice our schools with different goodies and pop sockets. If they invite us, we'll be able to give these materials. It's always well received, but it's a really great presentation and really setting some foundation on some of these substances. And more recently, we really saw that teachers were requesting information on vaping, right? We saw all over the news, there was E-Valley, and there was students, or there was even adults getting injured, lung injuries from vaping, right? Vaping is fairly new, right? And so there's a lot of misconceptions about it. So we touch on those misconceptions. We discuss what is vaping, what are electronic cigarettes, how did they get on the market, what are some of the health effects of vaping or even tobacco and nicotine. So one of the things that we find incredibly important is that you have to really discuss tobacco to really understand where vaping has stemmed from, because it's not often associated with smoking, right? It's called vaping. And when you think of vaping, you think of a vapor, right? Something that's generally safe. And so we want to make sure we touch on the facts. And so we also keep up with the latest evidence-based practices. We are not there to scare students and tell them that, you know, if they use a specific substance, they're going to die. Often that is a side effect or a health effect of, you know, using these substances, but we want to be very realistic in terms of what are some of the health effects of some of these products and what long-term effects you can have from that, as well as acute. And one of the fun things that we always do is that we share real Poison Center calls. Here are some real calls that we've had, and this is how this went about. So I mentioned that part of our outreach is through health and community fairs. That's really a great way for us to get our messaging out into the community, set up a table, meet the community where they are, give materials out, have an opportunity for education. And so this is kind of what our setup often looks like. Our brochures and material on our table just all generally depend on the type of event. And so if we're at a parent event, we're going to push more of our parent-oriented information. We try to get activity books to kids out and all kinds of information. Also, part of our job is to also share that information through media interviews. And so often, I know this week I had one radio interview in Spanish for 101.7. And so we just got to share this National Poison Prevention Week this week and what the goal of Poison Prevention Week, why is it important. And so we often go on both English and Spanish news stations and radio as well. And so that's definitely one of the fun parts about my job, is to really get in that outreach. Every year, we also host a poison prevention poster contest. And so usually the winners get drawn, or not drawn, they compete during this week, Poison Prevention Week. In the past, we used to give out a bike for first place, or Beats headphones, and a gift card. And so with COVID, we transitioned to gift cards, but we found that everyone just loves gift cards. So I think for the future, we are keeping gift cards, but first place gets $150. We actually just announced it on our social media. Second place got $100 Amazon gift card, and third place got a $50 Amazon gift cards. And the whole, really the goal of the poster contest is to raise awareness about poison. So we want to engage students to really learn what poisons are, and give them and tell us a message that they receive from that information they learned. So what do you want to tell others about poisonings? And so you'll see some of the posters that we've had here. We receive over 100 entries every year. It's very popular. And we also have a video contest. So this year we did a statewide. So I mentioned that we are a network. We did a statewide video contest, and they also give gift card prices. And so it's a great way to engage more of our older students, our middle school or high school. This year we opened it up to college students, and it's a really wonderful opportunity for them to also engage in poisons. Because as mentioned, it's Poison Prevention Week, and really we have a saying. It says, poisons span all ages. It's not just for children. And lastly, our free materials that are all available to order online. You simply go to www.poisoncontrol.org. I know our partners like Savannah, she also hands out some of our materials at events, just like we also have some of her collateral we give out. And so it's a great way to collaborate. So if you work at a school in an organization, or if you want your community to have materials, please contact Savannah. She has our materials as well. And you can also go online on our website and order those. We don't have a limit to the quantity, just because we want to make sure you have what you need in the community. But we are completely free. Any poison emergencies or even questions, we are available. So a lot of people know that when you call 911, it's usually for an emergency, right? So we do recommend that if you have a medical emergency, you definitely dial 911. If somebody passes out, if they can't breathe, is choking, those are 911 calls. If it is related to a poison, then the healthcare provider at some point will likely contact us. Be sure to follow us on our social media platforms. This is where you can keep up with some of the latest poison trends. This week, it's all about Poison Prevention Week. And so you'll see a lot of graphics that are focused on this week and why is it important, things and steps you can do. But we have lots of other things that we offer besides our social media. We have a blog and a newsletter. You can find that all on our website. And we are proud to announce that the network recently launched a podcast. And so if you go on a podcast platform and you search for Let's Talk Poison, you'll find the very first episode introducing what the network is about. And we have one of the doctors at the network who is actually speaking there. So we are so excited to have launched that this week. This is my contact information. If you want to get in contact with me, either about a program or materials, or have a question, post this presentation, feel free to note it down and give me a call. Yes, and so I'm going to pass it back over to Miss Savannah.
Thank you so much for sharing all of your information. I didn't realize you got a call every 2 minutes, so that is crazy. We are very fortunate to have a partnership with you guys and to have you so close in our region. And so we're very thankful for your resources and your education. And so far, we don't have any questions, but in the meantime, if anyone has any questions, please submit them. And I just wanted to ask real quick. So the theme for Poison Prevention Week this week is Here for the Ages. And you touched a little bit about, poison prevention and poison education for all walks of life. It doesn't matter if you're younger, if you're older. Could you kind of touch more on what the Poison Center's goal is for this week and the message?
Yeah, absolutely. We just definitely want to break down the myth that poison centers are only for children, because although that is a majority of our calls, the messaging this week is that we get calls from all walks of life, right? You may not be thinking of an adult getting poisoned, but often we get calls about adults maybe taking the wrong medicine, misdose, not dosing correctly, or you just have a basic question about a product, or maybe you were cleaning and mixing chemicals and it created a toxic gas, right? And you can't breathe. It's burning your eyes and your nose. Even from older adults, right? Maybe there is, an older adult with dementia and they have a hard time forgetting their meds or taking the wrong one, or maybe they also get into things. And so we want to just really emphasize that the messaging is really across all age groups, from all walks of life. So the Poison Center follows you all the way from infancy to being an older adult. And that's what you'll find in the messaging for Poison Prevention Week, is that we are there for you from beginning until end when you need us.
So thank you. And one thing too, I like to always point out is that it's not always an emergency, but if our families out there in the community, if your child or multiple kids are taking multiple medications at the same time, you might have a dosing question, or you may not understand necessarily how to give that type of medication. So that is also something that they can call you guys for if they have general dosing questions.
Yeah, no, thank you for bringing that up. Absolutely, right? So if it's 9 p.m. at night and maybe your child needs medicine and you need to give them, maybe they're teething, and that's actually giving you the scenario that I ran into recently. So although I work for the Poison Center, I've had to call myself because I'm not a clinician. And so the latest thing I had to call, it was 9 p.m. at night. I know my pediatrician's office is closed. I'm looking at the medicine and I'm reading the label, and it tells me this is the dose for your child for the weight, and this is the dose for the age. And I wasn't sure. And I literally called the poison helpline. I said, hey, this is how much my child weighs. This is the medicine I want to give my child. Can you tell me what is the safe dose for me to give my child? And so great example of that.
Awesome. Thank you for sharing that. And it's also a great resource too for our families. Like you said, if it's a time where you can't necessarily reach a pharmacist or your physician, your pediatrician, this is a great resource. So we did have one question in the chat, and they would just like to know where to find your new podcast again.
Yeah, absolutely. And so we're hoping to get that podcast out to more platforms. It is called Let's Talk Poison, and you can actually find it online as well. And so here I will, before we drop, I'm going to put the link in the chat. And so any of you who are interested in listening to the podcast, you can find it there.
Great. And I don't think there's any more questions, but just want to make a reminder that calling the Poison Center is always confidential and free, available 24 hours a day, 7 days a week, and in over 150 languages. So great community resource for us to use, and also for us to use if we're clinical. So the podcast link is in the chat. So thank you. And if there's no further questions, I think that concludes our webinar. Thank you to those who joined us today. And thank you, Lizbeth, for being on. Happy National Poison Prevention Week. And thank you for all you do in our community.
Yeah, absolutely. I'm so glad to be here. Thank you, everyone.
Thank you. Bye.